My name is Dr. Susan Albers. I'm a psychologist at the Cleveland Clinic. My specialty and my passion is helping people with eating disorders, healthy eating, mindful eating, any kind of issue that improves their relationship to food. Bulimia is a mental health disorder, and it involves two primary features. First is binge eating. And binge eating is defined as eating large quantities of food in a short period of time. A binge is something that is loosely defined, but the core feature that is shared among patients is this feeling of out of control, trying to stop eating and feeling unable to do so during that time period. The second core feature is a compensatory behavior. This is a type of purging to rid this amount of food. So this can include anything from self-induced vomiting, laxatives, enemas, diuretics, diet pills. For those who have diabetes, it may not be taking their insulin. It's also excessive exercise. So this may be defined as exercising for extreme lengths of time beyond what is healthy and necessary for you, being unable to stop. The first step in recovering from bulimia is to accept that this is a real issue in your life. It may be something that is difficult to accept for yourself and talk with about to other people. So the number one question that I may ask a patient when they come in is, how much of the day do you spend thinking about food? This can be a quite telling behavior because often there is a preoccupation thinking about food all day long, or it's impacting someone's focus, their concentration when they have other duties and responsibilities, but it's the primary thing that's on their mind. They also experience mood changes, depression, anxiety, irritability, also physical symptoms. One of the first things that I ask patients to do when they are diagnosed and assessed with bulimia is to connect with their primary healthcare physician to get blood work. And this is an important part of treatment to know how you are doing physically. There are different levels of treatment. The first level is outpatient treatment. This is what I would do in my office, meeting with someone once a week or every other week. We would work on what is known as cognitive behavioral therapy, and specifically for eating disorders. And some of the things that we would do is work on challenging diet culture rules that are ingrained in your head that make you feel guilty if you eat. We would also work on healthy ways of coping. If you take out the binge purge cycle, you have to put something else healthy in its place. This is often an ongoing treatment and working with a team of individuals. This includes a dietitian, psychiatrist, primary healthcare therapist, all working together. The next level is what is known as intensive outpatient. This is when you would like to work more intensively on coping with an eating disorder. So you may do a program that's 3 days a week, several hours a day. This is a more concentrated approach. The benefit is that sometimes you could really dive in a lot faster, and you are still going home at night and putting these skills into practice. The next level is partial hospitalization or hospitalization. This is when an individual is struggling medically. They may need some vital monitoring, they may need some intervention, some medication monitoring. The partial hospitalization means that you get these services, but you also are going home at night. And then the last level of treatment is residential. This is where an individual may go to stay at a treatment center and 24/7 are working on finding ways to cope with their eating disorder. treatment is very helpful. I've seen many people in recovery and who have recovered from eating disorders. They have a healthier relationship with food. They're eating more mindfully, and really very appreciative that the eating disorder is not the first and foremost primary center thing in their life.